Thank you. Our eye on tech continues. That's retail in the last segment, retail shopping, online data. Now we talk about telemedicine. In Nigeria, telemedicine stands as a beacon of hope, promising to revolutionize healthcare accessibility and quality. Leveraging the rise of digital technology and increased internet access, telemedicine in Nigeria is supposed to provide timely medical interventions, early diagnosis, and ongoing healthcare management. Not only improves health outcomes, but also is supposed to theoretically enhance the overall healthcare efficiency. Joining us now from Essex in the United Kingdom, Ayo Adebamowo, who is the CEO of My Medical Bank, the founder and the CEO of My Medical Bank. Thank you so much for joining us. Good morning to you, sir. So I think about 5 years ago, or was it 6, This Day newspaper, Nigeria's newspaper of record, profiled your company. How much ground have you made since then in terms of service delivery and scale?
Excellent. Thank you. Thank you very much. Good morning and good to be here. Yes, you're absolutely right. 5 years ago, we launched My Medical Bank precisely in Victoria Island, Lagos. So 5 years ago, when we started out, we for that particular event, we launched the first home care platform in Nigeria. So basically, just to kind of put it in context, so the My Medical Bank platform itself, it's an aggregate of data products, of digital platforms. So it's like bringing different platforms together in one location to make it easy for the consumer to be able to access healthcare services, from the convenience of their mobile phone. So simply look at it as trying to Uberize the health sector in the same way that people can just order for a rider on Uber and all of that. So it's the same way. So we started with home care, which was the first in Nigeria, like I mentioned. It allows consumers to be able to book, doctors, nurses, physiotherapists, carers to come and attend to them in the convenience on their own home. So we started at that, but since then we've actually launched a number of other products. So for instance, we have again another first for us in the country is a personal health record. This personal health record allows consumers to be able to, from the convenience of their mobile phone, store their their health data, their health information, health record, vaccination record, everything, put it together on the platform, and then managing their appointments with hospitals. So for instance, all the hospitals, all the diagnosis tests you've done, you have a record of it on your phone, and at the same time, you can be able to, check if you input your health data, for instance, your vitals, your blood pressure and all of that, it gives you advice or advisory information that, this blood pressure is high and all of that. So in a very simple nutshell, we've covered a range of, a significant ground. So currently on our platform, we have healthcare providers, that's hospitals, clinics, doctors, nurses, physiotherapists from about 27 states that are already onboarded on our platform, and of course, the number is still growing, so in a simple shell, so that platform.
The thing. So you mentioned, we're showing images of people on computers and laptops talking to doctors. You've mentioned, I'm holding my phone in my hand right now. Is telemedicine you're in Essex, in a country in the UK where you've got strong internet connectivity. Is this only for urban areas? This continues to be the pushback when we talk about telemedicine and technology. Is it only for urban areas? Because what would you tell me is your scale of coverage in rural areas in Nigeria where they don't have smartphones and laptops and so on?
It's a very valid question, and it's a question that keeps coming up. In fact, recently, I think early this week, the Nigerian Minister of Communications, that's what Dr. Bosun, was on Twitter. He was asking for feedback, from the Twitter community in terms of what their take in exploring or adopting telemedicine in Nigeria, particularly, of course, for the benefit of Nigerians, particularly from doctors in the diaspora, Nigerian doctors in diaspora. So in the rural area, you're absolutely right that telemedicine, requires internet. However, I think there's a misnomer that needs to be corrected. So the essence of telemedicine basically is to provide medical services, healthcare services remotely. So how that remote consultation is delivered, does not necessarily have to be powered by internet alone. So that's the first thing I want to correct. So, for instance, for people living in the rural area, there's SMS-based notifications. There are ways by which if people subscribe, to, let's say they have a telemedicine platform they subscribe to, there's a way that at least in the good thing about Nigeria is that there's a high data coverage in terms of SMS providers and all of that kind of stuff, telecommunication provider. So SMS based notification is one way. Number two, nurses and community health workers account for 80%, at least 80% of all health workers in Nigeria, health professional in Nigeria. There are about 450,000 health workers in Nigeria, doctors, all of them, but 80% of them are nurses and health workers. This is a very big pool. And this cohort of health workers, they are found everywhere in all the local governments of Nigeria, in the rural areas, in the urban areas, and all of that. So there's a great potential, for the government and, for private sector, like us as well, to be able to tap into that resource, So now basically the way it works is this. Of course, the rural area may not have internet connection and all of these, all of these kind of requirements. However, for this cohort of health workers, there are ways they can be empowered, that they serve as the medium, the platform, or the connection between those, the community, the rural community, and the healthcare consumer. So they can provide the link, to those healthcare professionals in the urban area. For instance, so let's say we have a nurse serving a community of 2,000 villagers, for instance. Yes, this particular person will be the face of the healthcare organization in that community. That anything that this person is unable to handle, then he or she can be able to escalate, to the exactly, okay. So there are many ways, that this can be definitely in the rural areas.
Okay, what about, it's funny you mentioned that tweet, because Dr. Bosun Tijani actually deleted that tweet because of feedback he got, right? Because he was asking doctors in the UK and America if they can use telemedicine to treat Nigerians, and people were pushing back, saying, well, what about the Nigerians here so are you worried? Does the outflow of medical professionals leaving Nigeria worry you, and does telemedicine solve that?
Yes, of course, definitely. It's a worrying situation in the sense that this jackpot phenomenon, we're losing a talent, so we can't deny that. And of course, that exodus is leaving a significant gap, within our healthcare sector. So from that perspective, it's a worry. However, there are positive side to this, to the jackpot syndrome, among the health workers. Now, in my medical bank, because we also have a telemedicine platform, and if you remember, I said at the beginning that our platform basically allows consumers, patients, non-patients, to be able to access a range of healthcare services, whether at home, what we call home care, whether virtually, what we call telemedicine, or in clinic. If they, so we connect the consumer with the doctors, with the hospitals, with the HMOs, and all of that. Now, with respect to the conversation at hand, Dr. Dojun's Tijani's, Bosun's tweet in particular. So we've had this conversation with doctors. I personally, I've spoken with a lot of doctors in the UK, in Canada, in the US, just to kind of gauge their opinion that, look, you guys, you were trained by the Nigerian government, you enjoy cheap education. Is there a way that you might want to give back to the country? You understand? Now, the truth is that a lot of our Nigerian doctors, they are willing to come on board. That's just the fact. In fact, there are doctors that on their own volition, they come regularly to Nigeria, to provide, maybe free telemedicine, free healthcare services, surgery and all of that. It's as a sense of patriotism. However, so the willingness is there, but I think the enablement, the platform needs to be created, and also more importantly, I think what also needs to be addressed is why they are leaving. And I suspect that was what kind of made a lot of people to be angry about Dr. Bosun's tweet. That you are not really addressing the fundamental issues that are driving those doctors away. Do you get my point?
Yep,
so
yep.
Exactly. So that is really the issue there, really, that look, okay, what can we do to encourage these doctors to stay? Can we make the health facilities to be more conducive for them? Can we make the working conditions, to be more attractive for them? Can we create training opportunities for them to progress in their career? Nothing was said about that. Do you understand?
Gotcha.
Exactly. So that's the main reason. So, but the willingness is there. The platforms like us, is doing that exactly. In fact, we have some doctors, who say, look, they don't even mind charging less, to be able to come on this platform here.
All right, a lot to be addressed. We thank you for joining us to talk about the potentials of telemedicine in Nigeria, Mr. Adebamowo, the founder and CEO of My Medical Bag. Thank you so much for your time.